Well, in 1997, I was doing a lot of international work. I was working in a number of countries, but I got distracted by one of my residents who was training with me at the IU Med Center. Dr. Joe Bergeron was a former pastor in California who wanted to do outreach in medicine in India. So he approached me and asked if I knew someone who would help him establish some medical programs in India, and I said, well, sure, I would be happy to do that. So in 1997, made 3 trips to India, the first in January of 97 and then returning in March of 97 and again in August. But during that time I was working with the South India Church of Christ Mission, and I worked with the Missionaries of Charity. I had the great blessing of meeting Mother Teresa, and it was then that I knew that I could do more to help the underserved population of the world. So the Timmy Foundation was begun in early 1997 with the idea that we could serve the underserved by activating the energy of our youth and taking them to areas that they would get an opportunity to discern if they were meant to be doctors, nurses, and therapists, while at the same time providing health care and education to kids that would not otherwise get it. Initially, we took a lot of adults and children, just people who were interested in doing, as we said, medical mission work, but obviously when you get on ground and you see what's going on in these places, you have to develop some infrastructure. But we had grade school kids up through grandparents who were working with us, and ultimately we realized a big part of the focus of the foundation needed to be shifted to nurturing this type of service learning for high school and college students. So the Medical Explorer curriculum was designed to show them the situations some of these children live in, take into consideration their culture, their geography, the epidemiology of a disease, political situation. What are all the factors that would keep this child from developing, from having the maximum opportunity for health and education, and therefore development? So the curriculum is then used within high schools and colleges to prepare the students for what they will encounter in the field. But ultimately, when I was 7, my life, there was a big change. My mom had told us there was a child who needed a home, and she said, what do you think? Should this little guy, Mikey, who was 2 years old, should he come and live with us? And I remember looking at my mom and I said, he doesn't have a mom? He doesn't have a dad? I mean, to me, that was inconceivable. So Mikey was the first of 150 foster children that came to our home over the next 20 years. And ultimately, I went to Purdue. I got a bachelor's in agriculture, but realized that my real calling was to take care of children.